All right, it's happening more and more. Young people and hip injuries, from athletes to everyday folks like you and me, even our own Lisa Ram. Hip problems are no longer just for those folks with, shall we say, a little more seasoning. Here with us this morning, Dr. Jon Hyman, to tell us more. And doctor, we used to hear about grandma falling and breaking a hip, or grandpa falling. It's not just for folks with a little age on them anymore. This happens more and more often, and we constantly hear about it.
That's right. We're seeing a lot more hip problems in teenagers and adolescents and people involved in sports of a high intensity level earlier in life. And we're learning a lot more about the problems that come about in hips too, so that we can help prevent people from ultimately going on to need hip replacement.
Yeah, I just had a friend, he's about 46, 47, had a hip replacement from an injury he suffered in high school. Lisa Ram, as we mentioned, just had hers replaced as well. Is there a reason? Are we more active than we were previously? Is that why we're seeing maybe more pressure put on the joint?
Well, I think part of it is that, yes, there is some increased intensity in some of the activities that people are engaging in, both with increased velocity and increased power, a lot more strength training and conditioning. We're also learning a lot more about them in terms of the technology that's available to identify problems earlier. It used to be that we just told people they had to live with your hip pain. We didn't really have a solution, and eventually it would deteriorate and you'd need a hip replacement. But now we're able to detect things a lot earlier and potentially make interventions to help thwart that.
Okay, you brought along a little model for us. Well, show us the model while we talk about some of the common hip injuries.
Right, so the hip, from an orthopedic perspective, is really comprised of the pelvic bone and the proximal femur, or the upper part of the thigh. And it's mainly, if you zoom in on that, you can see that there's a ball of the femoral head, which is cartilage, and then it goes into a socket, which is also cartilage, and then there's this ring of cartilage cushion around it called the labrum. And a lot of people will impact that with a forced repetitive flexion, or from repetitive torque and rotation from running or jumping. They'll actually damage that tissue. And we think that if we're able to identify that early, we can fix it and prevent the ongoing deterioration. And that's something we're doing now with a keyhole surgery called arthroscopic surgery, where we insert a small camera and figure that out.
And take a look. Okay. So how do we avoid some of these hip injuries? Because we just saw Venus Williams withdraw from a tennis tournament earlier this year with a serious hip injury. How do we avoid it?
Well, a lot of it has to do with proper conditioning and preparation, warming up, stretching, and really being aware of your body and listening to your symptoms. If you start to feel discomfort, that's a sign to maybe back off and modify a cross-train or take a break. If you push it too far, you can certainly cause damage and cause ongoing injury. And if you do experience such, you should check with your physician to get an evaluation.
Okay, so if it's not as serious as needing a replacement, how do you deal with hip pain? Because I would imagine rest is the key.
Yes, rest is the first line of defense, and sometimes over-the-counter anti-inflammatories. But if your symptoms persist for a week or two, oftentimes people seek evaluation, and they'll be referred for physical therapy or specific exercises with a therapist to help guide you through a healing process. And then occasionally there's injections and things that are necessary also. Okay,
here's our Lisa Ram right after her hip replacement, and there have been such amazing advances now. She told me she was up and walking the same day. There she is doing some therapy. You really don't have to fear hip replacement anymore.
That's right. There's minimally invasive techniques now that allow patients to recover a lot more quickly and get out of the hospital back into a familiar environment around loved ones at a much faster rate now.
Yeah, I was shocked. My friend told me they had him up and walking the same day as well. So, yeah, a lot of medical advances have been made in this area. Doc, thanks so much for sharing.
Thank you.
Always a pleasure.
Appreciate it.